All right, everyone, this video is about Pec Minor, which is on page 92, and we'll probably do subclavius with this video as well. So everyone turn to page 92. Got it? Okay, great. So Pec Minor is deep to Pec Major, and it kind of runs in the same direction as my hand here. So if you put your hand over your heart, like you would to say the Pledge of Allegiance, this is exactly where Pec Minor is going to be, and it's going to run in that direction. So the fibers are going to go slightly oblique to the ribs. So let's take a look at Pec Minor. Actually, let's go in here. We'll do that. Okay, there we are. So this is what Pec Minor looks like. It sits on the ribs just deep to Pec Major, like I said, and there are some other muscles in and around here, like on the rib cage right over here, there's going to be serratus anterior. And of course, you're going to have some other muscles like deltoid that's going to cover Pec Minor up in here. So obviously we've stripped away everything, and this is a deeper muscle. So just understand that in order to palpate this, we're going to have to go through other muscles and other structures. Okay, so Pec Major originates on the 3rd, 4th, and 5th ribs. 3, 4, and 5. Then the fibers run up this way towards the coracoid process, and that's the insertion. Now your book says it's the medial surface of the coracoid process, but coracoid process is fine, okay? And as far as the actions are concerned, look, there's a really nice acronym here. It's DAD, D-A-D. Depression of the scapula, abduct the scapula, which is also what? Protraction, right? So if you want to write that down, abduction is also protraction. Okay. Protraction, like bringing the shoulder forward, like you give an attitude, it's protraction. Okay, so depression, abduction, and downward rotation. So remember, we take that whole scapula, we tilt it down towards the floor, okay? Now, the interesting thing about Pec Minor is that because it attaches to the ribs, it assists with elevating the rib cage, which means it brings the ribs up and out during forced inhalation. So forced inhalation occurs mostly when you're exercising. I mean, you can force it and take a deep breath when you're sitting here like, but most people just don't do that. So when you're exercising, though, you do it quite a bit, especially when you're doing cardiovascular exercise. So Pec Minor is going to help lift and elevate the rib cage during forced inhalation. So that's one of its actions. So Pec Minor seems like kind of a small, innocuous muscle, but the problem with Pec Minor is that it sits directly on top of this structure right here. That structure is called the brachial plexus. Well, actually, that's part of it. And then it also sits on the brachial artery and vein. So the brachial plexus is this yellowish bit right here. It is a nerve bundle where the nerves come together in one sheath, and then they branch off as separate nerves. So you can see they come together here. So there's separate ones, and then they all come together in one, and then they branch off again. You see that? That's what a nerve plexus is. It's just a place where nerves come together and share a sheath for a little bit of time, and then they branch off. So you also have this red vessel right here. This is the brachial artery, and then this is the brachial vein. Now, these structures begin up in the neck here, in the cervical area, And we will talk more about that when we get to the neck, where this whole neurovascular bundle originates. But for now, we're just going to really focus on the structures in the shoulder here. Pec minor, as you can see, sits directly on top of this neurovascular bundle, which means that if pec minor is tight, it's a lot like piriformis, it's going to actually push on these blood vessels and nerves and compress them a bit, causing pain, numbness, or tingling down the arm and even into the hand. Because this one right here, it's hard for me to see, it doesn't look yellow on my computer very well. This one right here is actually going to end up being the median nerve. And the median nerve is the one that runs right through the carpal tunnel and can cause carpal tunnel-like symptoms. So having that neurovascular bundle compressed can cause symptoms of carpal tunnel syndrome. It can cause weakness, coldness, feeling like it's hard to grip things in the hands. So pec minor can cause a lot of problems here. Another issue with pec minor is that if this muscle contracts really tightly, like as in a spasm, it can actually send pain and numbness and tingling down the arm, mimicking a heart attack. Now, of course, if it's on the right side, it's not a heart attack, but if it's on the left side, it might feel a little like a heart attack, or a lot like a heart attack, actually. And that condition is called angina pectoris. And all that means is chest pain. That's it. So here's pec minor in your visible body. It looks a little weird. They don't have separate fibers for this pec minor here, but you can see it originates on the 3rd, 4th, and 5th rib here, 3, 4, and 5, and then inserts at the coracoid process. Okay, and like I said before, here's serratus anterior, right? So it's in there as well. This little guy right here is subclavius, and that's what we're going to talk about next. So let's go back here. We will palpate pec minor in class by going deep to pec major. So remember, you have those meat suspenders right here. We are going to be going up underneath pec major to get to pec minor. So it's going to be deep in here. And we'll probably do this in sideline position because that's easier. So subclavius then is on page 94. I need to go through here. 3 and 94. There we are. So subclavius is a little teeny tiny muscle, and its name means below the clavicle, subclavius. Its fibers, though, run pretty parallel to the clavicle, and it's rather difficult to palpate simply because all of this in through here is pec major, and of course pec major attaches to the clavicle there too, so it's going to cover subclavius. So we have this large, very dense, thick muscle covering this little teeny tiny muscle. So palpation of this is difficult at best. The other issue is that subclavius doesn't really cause problems ever. So no one's ever going to say, man, my subclavius really is bothering me today. That's just, it's not going to happen. So anyway, the subclavius attaches to the first rib and the cartilage of the first rib, and then inserts on the sort of interior surface, so up underneath the clavicle, specifically the middle 1/3 of the clavicle. So according to your book, it depresses, elevates, and depresses the clavicle, elevates the first rib, and stabilizes the sternoclavicular joint. So what it really does is stabilize the sternoclavicular joint. It's entirely too small to really affect the clavicle or the first rib in any significant way. So mostly stabilization is the action of subclavius. Now, in us, it doesn't really do much. It's really teeny tiny, but in quadrupeds, it's a lot larger, and it stabilizes the clavicle and the entire shoulder girdle during locomotion. Like when your dog or your cat walks, subclavius is going to be a lot larger, and it's going to be a lot more significant in their movement. For us, not so much. So again, here's little subclavius. You can see little subclavius, not doing a whole lot, just hanging out, attaching to the first rib, a little stabilization. All right, so that's it for subclavius and pec minor. When we come back, we will be talking about coracobrachialis. Stay tuned.